In this video we are going to talk about the therapeutic daily dose, maximum daily dose of metformin, and how we'll take metformin before or after meal. So let's start. So what is the dose of metformin in case of type 2 diabetes mellitus as monotherapy or in combination with other antidiabetic drugs including insulin? By mouth using immediate release medicines in child's 10 to 17 years, initially 500 mg once daily, dose to be adjusted according to response at intervals of at least 1 week, maximum daily dose to be given in 2 to 3 divided doses. In adults, initially start 500 mg once daily for at least 1 week, dose to be taken with breakfast, then 500 mg twice daily for at least 1 week. Dose to be taken with breakfast and evening meal, then 500 mg 3 times a day, dose to be taken with breakfast, lunch and evening meal. The maximum daily dose of metformin is up to 2 grams per day. By mouth using modified release medicines in adults, initially 500 mg once daily, then increased if necessary up to 2 grams once daily, dose increased gradually, every 10 to 15 days, dose to be taken with evening meal, alternatively increased to 1 gram twice daily, dose to be taken with meals, alternative dose only to be used if control not achieved with once daily dose regimen. If control still not achieved, then change to standard release tablets. In case of polycystic ovary syndrome, by mouth using immediate release medicines. In adults, initially 500 mg once daily for 1 week, dose to be taken with breakfast, then 500 mg twice daily for 1 week, dose to be taken with breakfast and evening meal, then 1.5 to 1.7 grams daily in 2 to 3 divided doses. How to take metformin tablet, glucophage. Take metformin with or after a meal. This will avoid you having side effects affecting your digestion. To stay up to date, make sure to subscribe to our channel. Thank you.